Hi, class. Today we'll be examining physical activity health campaigns. This presentation is brought to you by Erin Mishler, Sheyeen Bowden, Kaitlyn Mayo, and Gabriele Hall. So, just a quick overview. Today we will be discussing physical activity, just what it is, the importance behind it. We'll also be discussing our health campaign examples, which will include our poor example, average example, and great example. And then we'll also implement the specific theories that fit well with those examples, and then discussing the overall effective theory for physical activity. So, a quick explanation of physical activity. So, it is defined as any bodily movement produced by skeletal muscles that result in energy expenditure. Physical activity can consist of exercise, sports, and even physical activities performed as part of daily living, occupation, leisure, or active transportation. The importance of physical activity, it provides protective factor for diseases such as cardiovascular disease, stroke, diabetes, some types of cancers, and physical activity is correlated with improvement of mental health, also improves overall quality of life. Um, and then the health campaigns for physical activity will have the three different health campaigns that have been selected to identify a poor, average, and great health campaign that target a diverse audience. And then we'll also discuss what makes a good health campaign for physical activity.
So for the poor example, we have the Let's Move campaign. In 2010, First Lady Michelle Obama championed Let's Move, a campaign to combat childhood obesity. This was a multi-level, comprehensive campaign. It included the tagline, "Improve the health of Americans and eliminate childhood obesity in one generation." It had 5 pillars, and of those pillars, increasing physical activity was a focus. Let's Move used all the tools of a mass media campaign in addition to all the press that a first lady could generate. She also did interviews as well as magazine spreads, and a lot of those things were out in the forefront. The initiative worked with the Ad Council to develop culturally tailored messages to reach the nation and different ethnicities and people of social economic backgrounds. Uh, in the next slide, the constructs of social cognitive theory are discussed. And parts of the social cognitive theory are built into this initiative. Knowledge, which is seen in the focus that they placed on the connections between the parents and their children's personal factors and how physical activity is viewed. They also had environmental factors where you had accessibility to recess at schools and promoting recess in parks, along with behavior and opting to exercise. And that was all from the Let's Move website. Celebrities like Beyonce participated in flash mobs and dance challenges. And they also had athletes that promoted 60-minute clinics around the country. And these events encourage physical activity, and they also aligned with observational learning and modeling. They had PSAs that were directed to parents, and those provided tools about knowledge, and those things suggested that they would build self-efficacy. The Let's Move campaign was still considered to be a poor example because although it had a lot of heightened awareness from the First Lady's connection, there were a lot of gaps and that dampened its success. Unfortunately, a lot of the PSAs did not include statistics, nor did they let the audience know why their child was at a risk for childhood obesity. The audience is less likely to change any kind of behavior if they don't associate themselves or their children with any perceived risk. All the messages for the campaign pretty much stated the same thing, which was eat healthy and stay active. Anderson from 2016 deduced that if an initiative is not framed properly in the media, it will lose meaning to the public. And these are the reasons why this was not considered a good example.
For our average example, we are moving from children to adults, and specifically the 2016 uh, health campaign by Fitbit known as Find Your Reason, was a comprehensive strategy that utilized a fitness tracker known as a Fitbit. For the campaign, the company created a series of short videos utilizing adults of various ethnicities, ages, and abilities, enjoying physical activities, social media hashtags, as well as physical print media. The campaign ran on Facebook, Twitter, Instagram, YouTube, and other platforms. While this was a health campaign to be active, it was at the end of the day a marketing strategy to sell a product. The campaign lasted for several months and was considered a success by the company. The company identified users who owned a Fitbit and utilized the campaign, and how they showed a higher rate of intense exercise, exhibiting 45 minutes per day compared to users who did not participate in the health campaign, and how they only showed 28 minutes. But why exactly? Next, we'll examine some of the theory behind the success and failures of the campaign utilizing public health theory. Specifically, we'll talk about the theory of planned behavior and note a study by Reed in 2024, which identifies several aspects of fitness trackers with the behavior and how those are interlinked with the ad campaign. Specifically, we'll talk about the following constructs: attitude. The Find Your Reason campaign worked to modify subjects' attitude through a series of advertisements and social media campaigns, showing the success of those who used a fitness tracker. Subjective norms. According to Reed, the fitness trackers themselves may act as an influencer to increase social norms. A sort of, I have it, so I have to use it. The media's utilization of hashtags with the health campaign allowed users to see other success and how being fit was the norm for device users. Most importantly, perceived behavioral control. Both Fitbit and Reed work to give control back to those on their fitness journey. This can directly feed into both intention for the behavior and behavioral action itself. Fitbit's campaign utilized TPB through these methods to increase evidence of Fitbit working and encourage others to buy the product. However, this was only an average theory and not an excellent theory because of several flaws, including the ad ignoring the cost of the product, the cost of subscription, and ignoring signal issues of those who may live in rural areas and not be able to connect to the internet. Due to these impacting perceived behavioral control and ability to use the product, this falls back from a good to an average theory. Thank you.
When thinking of great examples of public health campaigns, it is important to look at campaigns that consider common barriers and benefits that the general public have. Many campaigns focus on one variable, like the Let's Move campaign we talked about, focusing on nutrition for an exercise ad, and the Fitbit not being accessible to one of the highest at-risk populations, those with low income or those with little to no wireless connection in rural areas. For our great example, we chose the Active People Healthy Nation campaign. This was created by the CDC that relays information on barriers, benefits, and physical activity education. The objective of this campaign was to help over 27 million Americans become active by 2027 by providing access to safe places for physical activity. The campaign is pretty universal when it comes to audience and can support any individual who becomes a part of it. However, there is a focus on those who have low income or have higher risks for low exercise, such as those in rural areas with little access and those who are older and aren't able to exercise on their own anymore. The specific infographic is from the Active People Healthy Nation campaign and explains the immediate and long-term benefits of being active. Some of the benefits I would like to point out are lessening activity, anxiety, and reducing blood pressure for the immediate benefits, and various kinds of preventative health like cancer prevention and lowering chronic diseases for long-term benefits. This campaign overall is considered a great example to us because of its understanding of all types of demographics and working towards increasing exercise accessibility and education to those who wouldn't have it otherwise. This infographic is considered great because it informs the viewer of the importance of exercise while giving that immediate gratification most people desire, but also explains the benefits that will occur long term by exercising. The benefits shown give those who are deciding on if exercise should be added to their lives an immediate reward, making their motivation increase. The theory that we think fits best with this infographic is the trans-theoretical model. This model groups people into different stages and exercises a behavior that people fluctuate throughout. The Active People Healthy Nation campaign target those who are in contemplation and preparation stage who are inactive but considering adding physical activity to their daily lives. The infographic explains the immediate benefits from starting exercising, stating that a single bout of moderate to vigorous physical activity provides immediate benefits. This means that once someone enters the action phase and starts exercising, they will see those immediate benefits. Additionally, as that person transitions to the maintenance stage, they will continue to gain more benefits, such as chronic illness prevention. In terms of self-efficacy, the different benefits tell the viewer that they will see the effects of their changed behavior, increasing perceived control of their ability to reach their goal. For decisional balance, the infographic shows that multiple pros of exercise. This supports the idea that exercise is more supportive than negative to a person's lifestyle, influencing the view to decide to exercise. And the paper that I found that supports this theory with exercise is Han et al., where he describes that the overview of the trans theoretical model is that when someone transitions through the stages, they see more benefits and disadvantages, and this infographic visually explains and supports that.
So we have decided that the trans-theoretical model change will be the best theory for a health communication campaign on physical activity. This theory is effective to be applied to the development of a health communication campaign on physical activity because it can describe how individuals can change their behavior by implementing physical activity into their day-to-day routine. It also helps determine an individual's readiness to engage in physical activity by looking into their attitudes, intentions, and actions. Progress stage may not be linear, but we are able to identify a person's stage, which can help guide the individual to an appropriate intervention to encourage them to progress through the stages and pick up the habit of continuous physical activity. For example, if someone is in the pre-contemplation stage, giving awareness by providing education of the immediate benefits and long-term benefits of physical activity. For the contemplation stage, an intervention can be to discuss the pros and cons associated with physical activity. Preparation, the stage could look like goal setting for the individual since they intend to adopt a new behavior within the next month. For action stage, this shows that people have made specific modifications in their lifestyles. An intervention that could be implemented is to encourage consistency of physical activity. And then for maintenance, focusing on preventing relapse. And this could look like encouraging long-term habits and how to overcome setbacks. And then here are references. And thank you for listening.